How are polyps removed during a colonoscopy? Imagine a tiny growth on the inside of your colon that could turn into something more serious if left untreated. During a colonoscopy, doctors can spot and remove these growths, called polyps, right then and there. It's a quick, safe process that helps prevent colon cancer. The doctor uses a long, flexible tube called a colonoscope, which has a small camera and channels for tools. When they see a polyp, they decide how to remove it based on its size and shape. For very small polyps, just 1 to 3 millimeters, the doctor might use small forceps. These forceps gently grasp the polyp and pull it off without using heat or electricity. It's a simple way to remove tiny polyps and reduces the risk of tissue damage. If the polyp is a little bigger, the doctor often uses a wire loop called a snare. The snare is placed around the base of the polyp and tightened. For small to medium-sized polyps, this is usually enough to cut it off. Sometimes, the doctor uses a technique called hot snare polypectomy. This method combines the snare with electrical current, which cuts through the tissue and cauterizes the area at the same time. This helps stop bleeding and destroys any leftover cells, lowering the chance of the polyp growing back. For polyps attached by a stalk, the doctor might use surgical forceps to grasp and remove them. After removal, the doctor carefully examines the site to make sure all of the polyp is gone. They may use electrical cautery or other tools to control bleeding. The removed tissue is sent to a lab for testing. This helps determine if the polyp is benign, precancerous, or cancerous. In some cases, if the polyp is very large or difficult to remove safely through the colonoscope, a small surgery might be needed. This involves removing part of the colon, but it is rare. Overall, removing polyps during a colonoscopy is a key step in preventing colon cancer. The doctor chooses the best method based on the size and shape of the polyp, always aiming for safety and effectiveness. This procedure is quick, minimally invasive, and can save lives by catching problems early.